Okay, so now as we move into really looking at the squat from the bottom up, I'm going to pay attention in this video a little bit more to a problem that I have with having high arches, which you can see I have pretty high arches. Now, when most people go into a dorsiflex position or they start to drop down into that squat positioning, you end up getting movement first at what's called the talocrural joint, and that's just this leg going forward. When it runs out of room, the next thing that happens is the subtalar joint, which is just below the visible ankle, starts to really flatten out. It kind of drops down, and you'll see that the person's arch will just depress. Now, with somebody who has naturally high arches, oftentimes it just doesn't go anywhere. There's nothing that can be done for that movement here. Now, what we'll often try to do with this type of foot is, as we get into our end range, we'll often try to use a little bit of a rotation that occurs naturally, but then drive our knee out to the side. And what ends up happening is we end up lifting the outside of our foot when we're no longer weight bearing on it. We're weight bearing predominantly just on that medial ridge. Now, the problem with this is this ends up limiting our overall stability, plus it also creates quite a load on the medial aspect of the foot, which can result in pain or me basically falling and busting my butt. So right about now, after the previous portion of the video, you're probably saying, well, this guy's just going to use these as an excuse to not work on his mobility. And I can tell you that that couldn't be further from the truth. The big thing that I've got to work on is trying to make sure I get as much motion out of my talocrural joint as possible, and then doing some simple mobilization techniques or movements in order to make sure I get as much movement out of the foot as possible. So let's go over a few things that you can do to help improve your mobility. Okay, so now there's a few different ways that we can go through and try to stretch that arch in order to push it down and get it to drop a little bit. Now, if we come forward, we need this to drop, so what we could do is simply mobilize it. You could use your fingers, something to create a little bit of tension is what will help that out. However, sometimes it's just not enough force. So if you take that foot and then you kind of get to your end range, take your opposite foot, hold on to something if you need to, in case your balance is a little bit off, but you're just going to put it right on that medial arch. And then as you come through, you're just going to bear some weight through this heel into that arch, helping feel it stretch out underneath that foot. And then just doing that repeatedly is going to help loosen up the joints. Now from there, we got to work on the rear foot, because remember, it swings a little bit. Let's show that over here. So with this exercise, I'm actually literally just going to grab onto the heel. I'm going to support it. You can either use your knee, or in this case, I'm just using a small ottoman. Here, what I'm taking is this portion of my hand and just coming on the inside of that arch. And then from there, I'm just going to press it down. Now, if you got a sharp edge on the backside, you can just put your other hand there to create a little bit of a cushion. And now I'm literally just bouncing back and forth to try to improve that motion. If you want to make this a little bit more lifelike, you can do a little bit of a movement into dorsiflexion, which is that angle here. So as I press down, I'm just doing a little bit of dorsiflexion to try to teach it how to keep that motion. So there you have it. I've given you a few different things that you can do to try to improve the mobility of the forefoot as well as the rear foot in order to help you out with getting into a deep squat.